We had 100 interviews. And when we got through talking to 100 people, we were absolutely inspired. And the reason for that was not that we talked to 100 happy, positive people. It was that they had a vision for the future of healthcare. They wanted doctors to be trained differently here. They had a vision for what could truly attract national funding and support for something that would truly be transformational. And then we started to say, this is America's next best academic health science center.
Spokane will become a destination health sciences center.
It's going to be a great economic boost for the area.
It will anchor this university district. It will catalyze all kinds of community growth.
It will be the magnet that will bring individuals into our community.
There isn't any project I've seen in 20 years that could accomplish what this medical school could accomplish for our regional economy.
To be able to have a project where you can actually deliver $1.6 to $2 billion of economic value to a region and to a state, to create 8,000 to 9,000 new jobs, high-paying family wage jobs. You could never recruit that. You can spend an entire economic development career trying to get that as your cumulative total for economic value you can create, and we can do that in one project.
Any community would benefit from a medical school, but with, 15% of the economy or 20% of the economy already in healthcare, Spokane is ideally poised to do this.
It's already our specialty, healthcare, providing quality healthcare services.
We have a $6 billion healthcare base already, 33,000 jobs in healthcare in this region already.
The fact that this campus is here, the 55 acres on a river in downtown next to the medical district.
The district has been designated. We have academic buildings here. We have the presence of our universities here.
But we need to build on that strength, lead with our strengths for the future. And one key cornerstone of that is a expanded four-year medical school.
Having a full medical school and all the graduate medical education that goes with it is a game changer.
There's going to be about 9,000 jobs, both directly and indirectly, sprinkled all over eastern Washington and Spokane. And those are going to be jobs at hospitals, on the campus at River Point. There's going to be jobs at physician offices. There's going to be jobs at restaurants and hotels and at the airport.
But also the eventual technologies that spin off and form companies and so forth, the biotech sector and things that will occur in this town because of it.
We'll have research going on here. We'll have development going on here. We'll have people designing products into a supply chain after that R&D has occurred here.
The research focus is really fascinating. For every $1 that's invested in research, the economic return is approximately $5.
And when you have that kind of economic opportunity and that kind of cultural opportunity, societal opportunity, healthcare opportunity, there's something in this for every single person in our community. Something in it for everybody.
There's a shortage of primary care physicians.
We are a net importer of physicians in this community, and we need to make sure that we do all that we can to grow our own.
We're confident that there will be more physicians that stay in this region and practice, both in the urban area of Spokane and in the rural communities.
After coming out here, I've loved it. It's an opportunity that I didn't know existed, but I think the more students that come out here, the more the word is being spread. And the more students will want to come out to Spokane. It won't be like a second option, but a first option that they really want over Seattle.
So 10 years further, 20 years further, the majority of the medical staff in the next century would be homegrown medical staff. And that's going to be a really, really important change because they're going to understand the culture, they're going to understand the community.
Medicine, more and more over time, is becoming a team sport where specialists and healthcare practitioners from all different areas come together to take care of the patient as a team.
So I think having medical students, dental students, nursing students, pharmacy students, physical therapy, occupational therapy, everyone together, training together makes a huge difference.
And we in Spokane, because of the work that we've done for the past 10 years of creating all of these different cross-functional opportunities with nursing and medical education and research, we can train them right here.
We already have a nursing school. We already have allied health fields like physical and occupational therapy.
A different kind of medical education, more interprofessional, interdisciplinary, and this campus is exactly that. It's already there.
You don't have to look very far to see what impact a medical school has on a community.
It's just going to make healthcare better. If you live in a community across the country that has a medical school, you typically get better healthcare because the bar is raised for all the institutions in town.
There will be more of a culture of education, which I think raises everybody's game a little bit.
When you're teaching medical students, you have to teach them at the gold standard. You have to teach them the best medicine.
So we'll be able to build upon the base we already have and add research and clinical experience for medical residents.
And that's very important for the consumers of healthcare, because once you take a basic discovery, translate it to the clinic, it now affects you, the patient. And Spokane will become a part of that game and actually be able to deliver the most cutting-edge treatments to our patients right here in Spokane and Eastern Washington.
Focused on one issue, and that is uncompromised health care in our community. And that's the beauty of the approach that we're taking.
I firmly believe that in your family, in your community, in your job, you have an opportunity to leave legacies. And I think as all business community leaders, we all look at an opportunity to say, what can we do to leave this a better place than when we found it? Think about Expo 74 and what it's meant to our economic vitality since 1974. You can't really put it into words or dollars. The rebirth of downtown Spokane and all of the hard work that so many people put into it. This is another one of those opportunities for our generation, for our group of community leaders to make that difference.
We're going to need everyone pitching in, embracing this bold, audacious concept of medical education here in the city of Spokane.
You don't just get the numbers by writing a report about the numbers. You get the numbers by every day working to make this happen.
It's going to take community focus. It's going to take a great deal of discipline.
It's going to require a big investment, more state dollars.
The economic impact report that we did showed that both local taxes and state taxes would pay back any investment that local or state government will put into this project over the course of the 20 years and every year after that. So it's a good public investment.
This investment will return opportunities for jobs as well as healthcare access for the population.
And we just simply have to stay focused to get it done, because these opportunities are just once-in-a-lifetime chances.
We need to move now and make this happen.
We need your help. We need your commitment. We need your dedication in that regard.